Hello guys, now we shall be discussing regarding the branches of your external carotid artery. Okay. So before we exactly discuss the branches of external carotid artery, we shall start on with the basics. What is external carotid artery and all, and then we shall be discussing all the arterial supply over the lateral part of your face. Okay, right. So let us start on with the basics. As you can see here, as you can see in this picture, coming out of your left ventricle, you have got your aorta. That is your aorta. Now, interestingly, this aorta, on the right side it is giving some branches, right? And on the left side it is giving two individual branches. Okay, on the right side it is giving a common branch, but on the left side it is giving two individual branches. Now this trunk or this branch, let me draw it with black color. This trunk or this branch, whatever you can see here, right? So this is called as brachiocephalic trunk. Brachio means it supplies to the brachium. Cephalic in the sense it goes to the head and supplies to the head. So brachiocephalic trunk, that is a common branch, right? So this common branch, let me write it down here. This is called as your brachiocephalic trunk. What is that? That is your brachiocephalic trunk. Now this brachiocephalic trunk is dividing into two branches. One branch goes to the right. Okay, one branch goes to the right and one branch is ascending up. Now this branch which is going to the right, actually it goes like this, guys. It goes in this way, on to the right side, right? It goes in this way. It passes below your clavicle. So anything below your clavicle is called subclavicular, right? So this artery is called as subclavicular artery or subclavian artery. Okay, so this artery passes below the clavicle and enters into your right arm. So this artery is called as subclavian artery. What is this artery called? This is called as subclavian artery. And what is this trunk over here? What is this artery which is passing up? This is called as common carotid artery. So a similar common carotid artery is also located on your left side, right? A similar common carotid artery is also located on your left side. So this is called as your right common carotid artery and this is called as your left common carotid artery. So this is called as your left common carotid artery, abbreviated by CCA, right? And this is called as your right common carotid artery. Right. And what is this artery over here? This also passes through the left side of the arm. This is called as left subclavian artery, right? So what is this? This is called as left SCA. It stands for left subclavian artery, right? Now this right common carotid artery and left common carotid artery in turn divides into two arteries, right? So one artery goes straight away into the brain, ascends into the head, but another artery is going, or another branch is going externally outward. So which is entering directly into the head, this is called internal carotid artery. Which is going externally outward, this is called as external carotid artery, right? So this would be your external carotid artery, whereas this one will be your internal carotid artery or ICA. So topic of discussion will be the branches of this external carotid artery. So topic of discussion today will be regarding the branches of this external carotid artery. I hope you are clear with the basics. Now what we shall be doing is that we shall directly put the external carotid artery here and see how this external carotid artery is supplying externally to different parts of your neck as well as your face and structures on the lateral side of your head. Okay, right. So I shall be numbering the arteries over here. I shall be writing down the arteries over here. Okay, so I shall be labeling them on the other side. Now from this picture, few important things you can see, right? So this bone which you can see here, this is called as your hyoid bone, isn't it? So this bone over here, right? So this is called as your hyoid bone. What is this bone? This is called as your hyoid bone. What is that? That is called as your hyoid bone. just below the hyoid bone, whatever this cartilage which you can see here, right? So this cartilage is called as your thyroid cartilage, not thyroid gland, it is thyroid cartilage, right? Thyroid cartilage. And by the way, remember one thing, cartilage is made up of which type of collagen, guys? Cartilage is made up of type 2 collagen. How do you remember? Instead of spelling it as cartilage, spell it as cartilage. Cartilage. 2 in the sense type 2 collagen. Okay. So cartilage is made up of type 2 collagen basically. So this is your hyoid. This is your thyroid cartilage, right? And all these are your tracheal rings. All these are your tracheal rings. Second important thing is that between the hyoid and thyroid, you see a membrane over here. Yeah. So that membrane is called as thyrohyoid membrane because it is present in between your thyroid as well as hyoid, right? So that you call it as thyrohyoid cartilage or thyrohyoid membrane. Thyrohyoid membrane. This you call it as thyrohyoid membrane. And another thing is that you see a membrane, right? You see a membrane between this thyroid cartilage. And by the way, what is the first? These are all not tracheal rings, obviously. The remaining are tracheal rings, but what is this first one? Yeah, just below your thyroid, just below your thyroid cartilage, you have got a bone here. What is that? That is called as cricoid, right? So what is this called? Cricoid. This is called as cricoid. Now, a membrane between cricoid as well as thyroid cartilage, you call that as cricothyroid membrane. What do you call it as? You call this as cricothyroid. Yeah, this you call it as cricothyroid membrane. Cricothyroid membrane. So these are some of the important things which you need to know. Apart from that, what is this muscle, guys? What is this muscle all the way hanging down? What is this muscle over here? Yeah, this is called as your sternocleidomastoid muscle, right? I hope all of you know this muscle. You're so familiar with this muscle, right? So this muscle is called as sternocleidomastoid muscle. What is that? Sternocleidomastoid sternocleidomastoid muscle. What is this muscle? Yeah, this muscle is named as sternocleidomastoid muscle. Another important thing, there is one muscle, right? There is one muscle. Obviously, this is a muscle of the neck, right? So this muscle, all the way it starts from the mental process. Okay, it starts from the mental process, and all the way this muscle goes and attaches to your hyoid bone. Okay. This muscle starts from here, goes and attaches to your hyoid bone. Now, this entire thing is called as the first part of the muscle. Okay, this is the first part of the muscle. What I am trying to tell you is that, let us say, see, this is the muscle actually. This muscle has got two parts. Now, this is the first part, this is the second part. Okay, now the first part starts from the mental process and all the way it goes and attaches to your hyoid bone. The second part starts from the hyoid bone and all the way it goes and attaches to your mastoid process, right? So this is your mastoid process over here. So it attaches to your mastoid bone. This is your mastoid bone. It attaches to your mastoid bone. Okay. So one muscle, what did I tell you? The first part starts from the mental process all the way it attaches to your hyoid bone. And from the hyoid, it goes and attaches to the mastoid, the second part. Okay. Now, the name of this muscle is called as digastric muscle. And this digastric muscle has got two bellies. If I am lifting my head up, you can see the first part anteriorly, right? This is called anterior belly. And another thing which is behind this anterior belly, the second part of the muscle, this is called posterior belly. So, if I have to show it to you here, look here guys, this part is called as, this part over here, this is called as anterior belly of digastric muscle, anterior belly of digastric muscle. Whereas this one over here, right, this part is called as posterior belly of digastric muscle, posterior belly of digastric muscle. Now you might get a doubt, anterior belly of digastric muscle, one end it is attached here to the mental process. Now the another end of the muscle is attached to the mastoid bone over here. Then what if this part becomes loose, right? What if this part becomes loose? Actually what happens is that there is a ligament, okay, not a ligament, this is like a tendon, okay, this is like a tendon, you see this tendon is present on this, what is this called? This tendon is present on this hyoid bone. You see, this tendon is hooking up on the hyoid bone. It is hooking what? It is hooking this anterior and posterior belly together on the hyoid bone. For example, this is the anterior belly, this is the posterior belly. There is a hook like this. Okay, so there is a hook like this, so that the anterior and posterior belly don't detach from the hyoid bone. To prevent the detachment of the hyoid bone, there is a hook like this placed on the hyoid bone. You see this hook? So this is a tendinous hook. Okay. So right, anterior belly of digastric, posterior belly of digastric. Cool. Now what is this muscle here? This muscle is called as omohyoid muscle. Right? What is the name of this muscle? This muscle over here, right? This is called as omohyoid muscle. What is that muscle? That is called as omohyoid muscle. Another very important thing. What is that important thing is that I hope you can see a triangle over here, right? So you can see a triangle on the lateral side of your neck over here. So this triangle, later on I'll tell you one thing, that this carotid artery, right, the external carotid artery, this carotid artery passes through this triangle. So you name this triangle as carotid triangle. You name the triangle as carotid triangle. Now the examiner will ask you that what are the borders of the carotid triangle? What are the borders of the carotid triangle, guys? If this is a carotid triangle, you know the borders. Anteriorly, right? Anteriorly, what do you have? You have got posterior belly of digastric muscle. Posteriorly, what do you have? You have got sternocleidomastoid muscle. Inferiorly, what do you have? You have got omohyoid muscle. Actually, it is antero-inferior, but you know, I don't want to complicate the thing. So, just learn what is carotid triangle and its borders. So, what I was telling you that anteriorly we have got posterior belly of digastric muscle. Posteriorly, we have got sternocleidomastoid muscle, and inferiorly we have got omohyoid muscle. So, all these three things together, you call it as what? You call it as a carotid triangle, right? So let me write down the borders. Anteriorly, you have got, what did you get anteriorly? You have got posterior belly of digastric muscle. Anteriorly, you have got posterior belly of digastric muscle. Posteriorly, you have got sternocleidomastoid muscle. Sternocleidomastoid muscle. Posteriorly. And inferiorly, you have got omohyoid muscle. Omohyoid muscle. Inferiorly, you have got omohyoid muscle. So these are the borders of your carotid triangle. Now, we are done with the basics now. Now let's start discussing the arterial supply, guys. So before I discuss arterial supply, I just wanna draw a small important thing, that look here. This is your common carotid artery, let us say. Okay? Or let us say this is your brachiocephalic trunk. Now this brachiocephalic trunk has got a branch all the way like this. Right, it has got a branch all the way like this. This is called as what? This is called as your subclavian artery, and another artery which goes up all the way, this is called as common carotid artery. Now this common carotid artery in turn divides into two, I told you, right? So One which goes like this is called as internal carotid artery, this is called as internal carotid artery, okay, and one which goes up all the way like this is called external carotid artery, right? Everything whatever I've drawn there, which I've told you, which I've explained you, the same things I'm discussing here. So this external carotid artery, it enters into the neck region like this. So this is an external carotid artery which is entering into the neck region. So once this external carotid artery, once it enters into your neck region, from here, this external carotid artery enters into your carotid triangle. You can see how this external carotid artery is entering inside your carotid triangle. Okay, that is the reason why you call this triangle as what? Carotid triangle. Now this external carotid artery comes all the way like this. It comes out of your carotid triangle. It comes what? It comes out of your carotid triangle, passes all the way like this, and it stops its division over here. This external carotid artery stops here. Now what will happen? Now from here, there is a small branch that goes all the way like this. Okay, so there is a small thick branch which is going all the way in this direction. Now what is the name of this artery? Look here guys, it's very simple. I can tell you that external carotid artery stopped here. It means this is the first branch of external carotid artery. Now what is this first branch of external carotid artery? Look here. This is your mandible, isn't it? This is your mandible. Behind the mandible you see this small opening here. This is called as internal acoustic meatus. It means this opening which you can see now in my ear, this is called as external acoustic meatus. If I remove the ear, the bony part has also got a hole, right? That is called as internal acoustic meatus. So this will be your internal acoustic meatus. So behind the mandible, in front of the internal acoustic meatus, the artery is passing like this, isn't it? The artery is passing like that. Now if you palpate this artery like this, if you put your fingers behind the mandible and in front of internal acoustic meatus, you can palpate this artery. You can feel the pulsations of this artery. If you are feeling the pulsation of any artery, it means the artery is not deep. The artery is passing superficially. Only then you can palpate the pulsations of that artery, right? So if I am able to palpate this artery, it means this artery must be superficial. Second thing is that this artery is supplying to which region of the bone? Which region of the head? Frontal, parietal, occipital or temporal? It is supplying to the temporal region. It is supplying to the temporal region. So I call this artery as temporal artery. As it is superficial, as I can palpate it, I can call it as superficial temporal artery. So let me put it as 1 over here. Let me put it as 1. So the first artery here, right? The first artery over here is called as superficial temporal artery. That is called as superficial temporal artery. So can I tell you that this is the first branch of your external carotid artery? Yeah, the first branch of external carotid artery is superficial temporal artery. And by the way guys, basically you call this superficial temporal artery as an anesthetist artery because whenever you are doing any kind of surgeries, right? So let us say that you are doing surgeries and near the patient's right hand and near the patient's left hand there is surgical team. So it would be really difficult to palpate the patient's right hand. It will be really difficult to palpate what? It will be difficult to palpate the radial pulse. So for that reason, what the anesthetic team will always be near the head region of the patient, right? Either to the right or left. So it would be easy for them to check out the pulsations here. So that is the reason why this is called as an anesthetist artery, right? But basically they don't use it. So there are other things which they can analyze the pulse and the saturations and all. But this is basically called as an superficial temporal artery is called as an anesthetist artery, right? Let me make a note of it, right? So this is called as anesthetist artery, okay? Keep this thing in mind. Right. Second artery now. What is the second artery, guys? The second artery is that, look here now, this artery, the second branch, this starts all the way from external carotid artery within the carotid triangle. Now this artery is coming from within the carotid triangle. Look here. This artery comes down all the way. It comes down all the way like this. Right? You can see this artery is coming down all the way down here. And this artery all the way goes and supplies here. Supplies to the top of some gland over here. What is this gland called? This gland is your thyroid gland. And this artery is coming down all the way and supplying onto the top of the thyroid gland, right? Not bottom of the thyroid gland. It is supplying to the top surface of thyroid gland. So you call this artery as superior thyroid artery because it is supplying from the superior side, isn't it? So this artery, it supplies the top, the superior surface of thyroid gland. This is called as a superior thyroid artery. What is this? Superior thyroid artery. I am naming it as 2, right? So this is called as superior thyroid artery. Superior thyroid artery. Okay. Now listen very carefully. From the superior thyroid artery, there is a small branch. And this branch, it supplies all the way. It gives a small branch, and this supplies all the way to the cricothyroid membrane. You can see from this superior thyroid artery, a small branch is supplying to cricothyroid membrane, and this artery is called as cricothyroid artery. Okay, can I make a note like this? That one branch is called as cricothyroid artery. One branch is called as cricothyroid artery. There is another branch. Look here. Now this branch is also a branch of the superior thyroid artery, and this branch goes all the way and supplies to your what? Thyroid membrane. It is supplying to a thyroid membrane. So can I call it as thyroid artery? Another branch is called as thyroid artery. Another branch is called as thyroid artery. Let us look at the third branch. Okay, let us look at the third branch. Now the third branch is that this branch, look here very carefully, this branch is supplying exactly below which bone, guys? Yeah, this branch is supplying below which bone over here? You see, this branch is supplying just below your hyoid bone. This branch is passing just below your hyoid bone. So if it is passing above your hyoid bone, I call it as suprahyoid. If it is passing below the hyoid bone, I call it as infrahyoid. Right? So this branch is supplying to the surface below the hyoid bone. I call this as an infrahyoid artery. The next branch will be infrahyoid artery. Clear? So what was the first branch? The first branch was called a superficial temporal artery. What is the second branch? The second branch starts from the carotid triangle, comes down all the way and supplies to your thyroid gland from the top. So you call it as superior thyroid artery. And one of the branch of superior thyroid artery pierces into this cricothyroid membrane. So you call it as cricothyroid artery. Another branch pierces into the thyroid membrane. So you call it as the second one, thyroid artery. The third branch, it passes just below your hyoid bone, so you call it as infrahyoid artery. Clear? So we are done with the two main arteries now. We shall be discussing the third artery now. Now before I discuss third artery, you should be aware of one thing, that you have got your tongue over here, right? This is your tongue. This is your tongue. Okay? Now the third artery, now this artery also starts from within your carotid triangle. Now look here. This artery all the way comes like this. right? Now this artery comes all the way like this and it passes over the mandible and it enters into the face and it supplies to your tongue. This artery supplies to your tongue. Now this artery supplying to your tongue, you call this artery as a lingular artery, right? What do you call this as? A lingular artery. So can I write it as number 3, right? Number 3 is your lingular artery. Now, what are the branches of lingular artery? What are the branches of lingular artery are? One branch supplies onto the top of the tongue. One branch supplies onto the top of your tongue. So you call it as, see, for example, so let us say that this is the tongue region, okay? This is the tongue. Now, on the surface of the tongue, whatever you can see here, this is called as the dorsal surface of the tongue. If I lift the tongue, this is called as a ventral surface of the tongue. And what is this entire hollow space? This is covered up with the muscle, the tongue muscle, right? It is covered up with the tongue muscle. So this will be your dorsal surface, this will be your ventral surface, and this is the tongue muscle. Now if you look, this artery is supplying over the dorsal surface of your tongue, isn't it? This artery supplies over the dorsal surface of your tongue. So you call this artery as dorsal lingular artery. What do you call it as? You call it as dorsal lingular artery. Okay, dorsal lingular artery. Next artery and the third artery. What is the next artery? Now look here. This lingular artery also gives a branch which supplies into the deep portion of the tongue. It supplies deep inside the muscle of the tongue. So you call it as deep lingular artery. What do you call it as? Deep lingular artery. Deep lingular artery. Third important thing is that this lingular artery also gives a branch which supplies just below the tongue. So what did I tell you? I told you that if below the tongue, that surface you call it as ventral surface. So can I call this as ventral lingular artery? Yeah, I can call it as ventral lingular artery. I can call this as ventral lingular artery. Okay, so what are the arteries so far we have discussed, guys? Right, what are the branches? One is called as your superior thyroid artery. We have discussed the lingular artery, and we have discussed your superficial temporal artery. Okay, and by the way, yes, these are your minute branches like this. One have to remember definitely. Right, now there is another artery. Look here. This artery, obviously it starts from the lingular artery itself. Okay, this artery starts from the lingular artery. Now this artery comes down all the way like this, and this artery is passing just above your hyoid bone. Now you tell me, what is this artery should be called as? This artery passes just above your hyoid bone in this way, and it is a branch of your lingular artery itself. Now, if it is passing above the hyoid bone, you call it as suprahyoid artery. Previously, there was a branch, that is a branch of superior thyroid artery, which was passing below the hyoid bone. So, you call it as infrahyoid artery. Now, there is a branch passing above the hyoid bone, so you call that as suprahyoid artery, right? The branch is called as suprahyoid artery. You call the branch as suprahyoid artery. Now let us discuss the fourth important branch. Now there is a branch which comes all the way like this. I mean, obviously it originates from your external carotid artery, and this branch passes over the edge of the mandible, right? This branch passes over the edge of the mandible and enters into your face like this. So this branch passes over this is called as angle of the mandible or edge of the mandible, right? So this branch passes over the edge of the mandible and enters into the face. If you want, you can palpate the angle of the jaw. You can very well feel this artery, and this is called as a facial artery because it is directly it is entering into your face. Okay. Now this facial artery gives out some branches. Okay. Now what are the branches? Look here. Eye has two angles. This is called as the medial angle of eye, and this is called as the lateral angle of eye. Right. So one branch supplies to the medial angle of eye like this. One branch supplies to your medial angle of eye. So can I call this as medial angular artery because it is supplying your medial angle? Yeah. By the way, what is the name of this artery? This is called as a facial artery, and facial artery has got a branch, and that is called as medial angular artery. Medial angular artery. Facial artery also gives a branch that supplies to your nose region. Not exactly to your entire nose, but it supplies to the lateral side of your nose, the lateral part of your nose on either side. So I can call it as lateral nasal artery. I can call it as lateral nasal artery. I can call this as lateral nasal artery. Third important thing is that it gives out a branch that supplies to your upper lip. You know, what do you call your upper lip as in the Latin? You call it as superior labii, right? Superior labium. And this you call it as, the lower lip you call it as inferior labium. So it is supplying to superior labium or the upper lip. So I can call this artery as superior labial artery. I can call this artery as superior labial artery. And obviously, yeah, it even supplies to the lower lip. So I can also call it as inferior labial artery. Inferior labial artery. It even supplies to your lower lip. I don't want to make this picture a fussy, so that is the reason why I am not drawing it. Right, so I don't want to confuse you. So just think that there is a branch supplying to lower lip, that is called inferior labial artery. The next branch arises outside the carotid triangle. It starts from outside the carotid triangle. Look here very carefully. This branch starts from outside the carotid triangle. This branch comes all the way like this. Okay, and this branch supplies to your maxilla. This is the major branch, right? This is a major branch like this, and this major branch is supplying to your maxilla in this way. So I call this artery as maxillary artery. What is this artery called? Maxillary artery. Artery number 5 is called as what? Artery number 5 is called as maxillary artery. Now, another important artery is that there is an artery which starts within the carotid triangle. Now, this artery passes back in this way, right? This artery comes out of the carotid triangle, and this artery, if you can see here, right? So, this artery passes above like this in this way. This artery passes like this, and it supplies to your occipital region completely in this way. So this is called as occipital artery because it is supplying to your occipital region, right? So this artery is called as what? Artery number 6 is called as occipital artery. Artery number 6 is called as occipital artery. And the next artery is that all of you know there is a bone over here. What is this bone? This is called as zygomatic process, right? And this zygomatic bone is exactly nearer to your orbit. This zygomatic bone is exactly nearer to your orbit. Now, if I put an artery which is arising from this external carotid artery, look here, this artery right now is passing. Let me draw this thing as well. All of you know you have got your zygomatic process like this. You have got your zygomatic process like this, right? Now this artery is passing exactly parallel to the zygomatic process towards your eyeball. This artery is passing exactly parallel to the zygomatic process towards your eyeball. So can I call it as zygomatico-orbital artery? Yeah. The next artery is zygomatico-orbital artery. The next artery will be zygomatico-orbital artery, right? So I think we are done with the branches of external carotid artery. So what are the branches of external carotid artery, guys? Superficial temporal artery, superior thyroid artery, lingular artery, facial artery, maxillary artery, occipital artery, zygomatico-orbital artery. If you remember the main branches, that would be more than enough. But if you for the exams, these are enough. But if you wanted to know much more, then these small branches also you have to remember. I don't think so that it will be much difficult or tricky for you to remember, because all of these names originate from the places where those branches are supplying, right? So I think it would be pretty easy for you to understand all these names, right? So I hope, but anyways, remembering the main names, the main arteries is enough as far as the exams are concerned. So this is all you need to know regarding the external carotid artery. Thank you so much for watching my video. Goodbye.